I'm now turning to the Honorable Maha Barakat, and coming from the host country of COP28, she will focus on the intersect between health and climate change. Maha.
Thank you. Thank you very much for inviting us again to participate in this very insightful Congress, actually, and we're very grateful. I will argue that health actually is a critical component of climate change, and much of what you've heard already, be it pandemics, be it effect on water and so on, much of it can be encompassed under the umbrella of climate change. So many of the global health challenges that we have to deal with today can fall under the causation of climate change or become much worse because of climate change. And this slide really is a summary of how climate interacts with health. So climate is a health crisis. The climate crisis is a health crisis, and that's been stated on a number of occasions by the WHO. And this chart really summarizes the relationship between climate and health. The graphics has come from the WHO directly, so this is something you can all seek from the WHO website. And if we can just concentrate on the diagram at the bottom, I'll just go very briefly through all the elements of how climate will affect health, both in terms of inducing illness or causing death. And it's been estimated that by the end of the century, climate change will probably be taking over 9 million lives every year directly related to the climate. So it affects extreme weather events, and we've just seen recently in Spain and Valencia the devastating effects of that. There are heat itself. Just having too much heat can cause heat stroke and other issues. Respiratory illness, an increasing burden of asthma, lung cancer, chronic obstructive lung disease. We have waterborne illnesses. We've just heard about cholera, and there are others, for instance, polio. There are zoonoses, so these are diseases that start in animals and jump into human beings. And many of the epidemics, and for instance, the pandemic that we've just had was a zoonosis, something that started in an animal that jumped into humans. So that relates to COVID-19, certainly relates also Mpox and to swine flu, avian flu, and all of these influenza viruses that started in an animal and jumped to humans. The next diagram is vector-borne diseases, and two of the very well-known vector-borne diseases are malaria and dengue. The four that I've just mentioned, or the three that I've just mentioned, the waterborne, the zoonoses, and the vector-borne, these three will be the cause of the next pandemic. One of them or all of them will be the cause of the next pandemic. And they certainly significantly contribute to antimicrobial resistance, because the more fevers, the more people will be prescribing or taking or self-prescribing antibiotics. So I think these disease-inducing factors that are made much worse or even caused by climate are going to be causing much of global health issues, including things like antimicrobial resistance. Then we have food, obvious things, lack of food, lack of water, non-communicable disease, and we heard a little about that now, but we'll hear more from our next speaker. Then you have mental health. You should never forget the impact of climate change of mental health. For the purposes of my discussion today, I'll just focus on two of the elements. I'll focus on vector-borne disease and air quality. So what do we mean by vector-borne disease? So vector-borne disease really is some virus or parasite that sits inside another host, and usually a flying host like a mosquito, that goes then to bite a human being and then inserts its disease into the human being. And the most well-known is the mosquito. The mosquito is very good at taking something, circulating it in its own system, and then squirting it into a human being when it wants to feed. And there are different types of mosquitoes. We all know about the one that causes malaria, and that genus is called Anopheles. So that's the Anopheles malaria. But there are others. The Aedes genus causes dengue, and then we have the Culex that can cause West Nile fever. These are responsible for millions of deaths, and historically you'll find evidence of malaria from pharaonic times. So these are not new diseases. The malaria is not a new disease. It's been around for centuries, and climate change is going to make it worse. This scene is all too often seen in rural areas of Africa. Over 90% of malaria burden is in Africa, and you frequently see these tragic scenarios of children with cerebral malaria, and this has a very high mortality rate. In last year's World Malaria Report, there were an estimated 608,000 deaths from malaria, an entirely preventable and treatable disease. 608,000 deaths, mostly children under the age of 5. And that number is going to become almost 1 million in the next 4 years. This is a disease that continues to kill children at staggering rates. And more children died of this than they did from COVID because they had a febrile illness. They thought it was COVID and they were sent home when actually it was malaria and it should have been treated. This is a worrying escalation of the malaria problem in Africa. There's a mosquito species, Anopheles species, called Anopheles stephensi, which didn't used to be in Africa before 2011. And all of a sudden, with global warming, it seems to have migrated into the African continent. And the problem with this species of Anopheles is that it likes to bite during the daytime, and it seems to be resistant to several important insecticides. So the current mainstay of preventing malaria in Africa, the bed nets, so people sleep at night on the bed nets and using the well-known insecticides. This mosquito is making a mockery of these measures because it's biting during the day when people are walking around and working and studying and doing things during the daytime without bed nets, and it's resistant to many of the insecticides we see. So despite all our efforts to try and tackle malaria, there are ongoing and new and emerging threats, and this is one big threat, and lots of R&D is going into how to deal with this specific species of Anopheles. We move on to dengue. This is another mosquito genus. It's Aedes. And if you can see how Aedes has transitioned through the centuries, through the decades. So in the top slide is 1950, then we have to 2020, then we have 2050. You can see how slowly and we believe it's because of global warming, it's slowly encroaching areas where it didn't used to be. And most continents are now affected by dengue. This is a recent 3-month incidence map from the European CDC, and you can see how it's now very much in the Americas, both north and south, and central. There are 14 million cases so far this year of dengue, and probably much more because it's just not diagnosed in many parts of the world. So again, dengue, and why are we worried? You think, well, it hasn't killed many people, it's only 10,000 deaths. The problem is we don't have any treatment for it and we don't have any vaccines. And this is getting worse. As the world gets warmer, this is getting worse. So again, watch this space with climate change and vector-borne disease. We can move on now to air pollution. We've heard briefly just how air pollution is affecting the world. These are just 2 recent news reports last month. the left is Lahore and the right is New Delhi. There's a very senior thoracic surgeon from New Delhi who publishes widely on this topic. And basically what he is saying is you have what you used to see in the 1980s is very different to what he's seeing now. Over 50% of cases of lung cancer now in New Delhi are from non-smokers. And this was unheard of before. More than 90% before used to be from smokers. Now over 50% of lung cancer is in non-smokers, and he's seeing it in younger and younger people. And you can see the lung on the right is from a non-smoker in New Delhi. The lung on the left is somewhere else in the world. And that brings us to what happened in COP28 last year. For the first time in any COP, there was a dedicated health day. It happened on the 3rd of December. It recognized the significance of climate on health. And during the dedicated health ministerial that happened on the 3rd of December 2023, there were three focus areas. One was public health measures to protect against climate change. Secondly, health system strengthening, prepare the health systems for the increasing and the ongoing climate effects. And thirdly, promoting climate responsible actions, low carbon energy sources. The WHO again has been a champion of this. And they have listed the different factors that are important in making health systems climate resilient. And we see governance, leadership and governance. This was critical in COVID-19. We all recognize the importance of leadership and governance. And that made a huge difference between the countries that were successful in dealing with it and those that were not so successful. How leadership dealt with COVID-19 was very telling. But anyway, leadership, financing, workforce, and health system strengthening, these are the key factors. A declaration was agreed and signed by over 150 countries. And I remember when we started the draft declaration, we were told by the WHO, you'll be lucky if 50 countries sign up. That would be a great, story of 50 countries. Actually, by the time we had it, many more than 50, and we finally have 151 countries endorse the Climate Health Declaration. And what is the legacy? The legacy is not this declaration. The legacy ultimately will be how many lives will be saved as a consequence of the actions that started in COP28. It's all about how many lives. And ultimately, you can argue, not just in the health, everything else. How many lives will be saved? Everything that has been agreed for COP28 and COP29 and will be agreed in COP30. How many lives are you going to end up saving? And never, the financing. Financing is also important. So with this, I end my intervention, and we wish Brazil all the best for COP30, and they're already making huge progress on that sector. So thank you.
Thank you.